Hi, and welcome to another presentation in my series, Medication Class, The Pivot Perspective. Here's a necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your own healthcare provider before changing any of your medications or starting a dietary supplement. This presentation and other information on my website are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions. Hello, my name is Dr. Amy Naprick. I am the founder and CEO of Pivot Integrative Consulting. I'm a Doctor of Pharmacy graduate from Creighton University School of Pharmacy and Health Professions, licensed to practice in the Carolinas and Georgia. I'm proud to say I became board certified in lifestyle medicine last year, and as a diplomate from the American College of Lifestyle Medicine, I'm excited to share this information with you. I'm also an integrative pharmacy specialist, which just means I've been trained to look at health a little differently. I look for root causes of disease, which can stem from nutrient deficiencies, gut health, or imbalances within the body. I'm committed to evidence-based practice and lifelong learning. Because of this training, I'm a pharmacist who loves to help people decrease reliance on prescription medications and use more natural things like food to heal their body. Today, we are going to talk about acid-reducing medications and micronutrient depletions. For today's objectives, we'll answer the following questions. What are acid-reducing medications and how do they work? What are some side effects from these medications? What micronutrients are depleted by acid reducers? Why is gut health so important? And where can you get more information? Let's talk a little bit about acid-reducing medications and explore why this might lead to certain complications with health and wellness. In the 1960s, a group of researchers in England started a project to prove the existence of histamine receptors in the stomach that triggered the release of stomach acid, and to create a medication to block those receptors. This led to the discovery of cimetidine, otherwise known as Tagamet, in the 1970s. This was one of the first blockbuster drugs on the market and a huge step in reducing stomach ulcers. Also in the 1970s, proton pumps were discovered in the stomach lining and linked to the final step in the secretion of gastric acid. Through many phases and trials, omeprazole was released under the name Prilosec in 1990. However, starting as early as 1982, it was discovered that a bacterium called Helicobacter pylori, or H. pylori, was associated with an increased risk for stomach ulcers. Just blocking the stomach acid with histamine blockers and proton pump inhibitors was not enough to prevent reoccurrence. This didn't stop the manufacturers from seeking over-the-counter status for these medications. Pepcid, the strongest H2 blocker, was approved to go over the counter in October of 2000, and Prilosec followed in June 2003. So here's a diagram of where the acid-blocking medications work. As you can see, the histamine-blocking medications block histamine from interacting with the H2 histamine receptor, which blocks the proton pump mechanism from releasing stomach acid. Proton pump inhibitors act directly on the pump itself to shut down acid production. So both end up blocking the same mechanism called the proton pump. A fancy name for heartburn is GERD, or gastroesophageal reflux disease. The sphincter, which is the opening between the esophagus, or food tube, and the stomach, relaxes and lets acid travel up the esophagus, which causes the burning and pain sensation in the chest. Coughing and hoarseness can also be signs of GERD. As of 2019, it is estimated that 18.1 to 27.8% of Americans suffer from GERD, although the number may be higher due to the availability of acid-reducing medications without a prescription. GERD has been linked to many lifestyle factors, including smoking, obesity, eating late meals, high consumption of fatty or spicy foods, alcohol consumption, and sleeping position. Blocking the acid pumps alone does not address these other lifestyle factors. It doesn't explain why the sphincter is relaxing in the first place. It is true that when stomach acid moves up the esophagus, it can cause damage to the esophagus called erosive esophagitis. Sometimes this damage can change the kinds of cells located there, which can lead to esophageal cancer. This condition is called Barrett's esophagus. This is a very serious condition caused by acid reflux into the esophagus. But how can you treat the underlying causes of such a condition in the early stages so that medications may not be necessary? More on that in a little bit. First, let's look at the classes of acid reducers that might be prescribed. Here we have our antacids. These are used to neutralize the acid and are used for the occasional heartburn symptoms. These include calcium carbonate, also known by the brand name Tums, sodium bicarbonate, or Alka-Seltzer, and aluminum and magnesium combinations, which are also known as Maalox or Mylanta. Here are the histamine blockers. These target specific histamine receptors in our stomach that trigger the acid pumps to release the stomach acid. These medications include cimetidine, ranitidine, which was removed from the market in 2020, famotidine, and nizatidine. And some of these are available without a prescription. Now we have our proton pump inhibitors, omeprazole or Prilosec, S-omeprazole or Nexium, lansoprazole, which is Prevacid, dexlansoprazole, which is Dexilant, pantoprazole, Protonix, and rabeprazole, which is Acifex. These were originally intended to use for a short term of 2 weeks or less to give the esophagus a chance to heal from too much acid that damages the cells of the esophagus. These medications were then supposed to be discontinued. However, we have seen patients take these for decades. Since the body will compensate for the reduction in the functioning acid pumps by making more pumps, when you try to stop this medication after taking it for that extended time, all the pumps will start releasing acid again. This can lead to worsening heartburn symptoms for a short period of time while the body readjusts. It is important to use dietary and lifestyle changes prior to discontinuing these medications to reduce these effects. Let's look at side effects for acid-reducing medications. Some side effects from antacids can include constipation, nausea, vomiting, and abdominal cramping. Long-term use can sometimes lead to nerve damage and weakened bones. Side effects for histamine-blocking medications include headache and fatigue, GI issues like diarrhea or constipation, dizziness, confusion, especially in the elderly, muscle cramps, and pain. I felt it was important to caution you about the potential for drug interactions with the histamine blocker cimetidine. While it is available over the counter, that doesn't mean it is safe for everyone to take. This is not even a complete list of all the medications that cimetidine can interact with, so I would encourage you to contact your pharmacist to verify any drug interactions before taking this or any medication. As I said previously, proton pump inhibitors were intended to be used for less than 2 weeks. So the short-term use of proton pump inhibitors has some side effects, including headache, rash, dizziness, and GI issues like nausea, abdominal pain, flatulence, and constipation or diarrhea. But let's be honest. Most people who take a PPI do not just limit its use to 2 weeks. I've known patients who have taken a PPI for years, even decades, and are afraid to come off of it due to the increased heartburn effects that I mentioned before. However, the risks for staying on the PPI are significant. Side effects can include an increased risk of a serious infection, like Clostridium difficile. If you have heard of some of my other presentations or read on some of my blog posts, I've also discussed small intestinal bacterial overgrowth. This means the wrong kinds of bacteria have a chance to grow or multiply in areas they shouldn't. Bacteria like Salmonella, Campylobacter, and Enterococci can cause inflammation and infections in the stomach, liver, gallbladder, and lungs. There is also a possibility that proton pump inhibitors can damage the kidneys, but the way is not known. It is known that proton pump inhibitors can cause nutrient deficiencies, which I will go into detail about in the next section. These deficiencies are linked to bone fractures from low calcium and magnesium absorption, and anemia from low B12 or iron levels. There are also studies linking prolonged PPI use with dementia. That leads us to our micronutrient depletions of acid-reducing medications. Sodium bicarbonate, also known as Alka-Seltzer, can deplete phosphorus, folate, iron, and chromium. The aluminum and magnesium antacids, like Maalox and Mylanta, can deplete vitamin A, vitamin D, folate, calcium, chromium, phosphorus, iron, magnesium, and zinc. The H2 blockers, like Pepsid and Tagamet, can deplete folate, vitamin B12, vitamin D, calcium, iron, and zinc. And the proton pump inhibitors can deplete folate, vitamin B12, vitamin C, calcium, chromium, iron, magnesium, zinc, and damage the gut microbiome. Since there are many overlapping depletions, let's look at each in alphabetical order. Let's start with vitamin A. Vitamin A is a group of fat-soluble vitamins that include retinol and retinol esters. Vitamin A is essential for eye health and vision. It also helps with cellular growth and maintaining surface tissues like our skin, but also the intestines, lungs, bladder, and inner ear. It is essential for immune function by supporting the growth and distribution of T cells, which is a form of white blood cell. Vitamin A also supports reproductive health in men and women. Vitamin A deficiency is rare in the United States, but still common in many developing countries. According to the World Health Organization, vitamin A deficiency is the leading cause of preventable blindness in children worldwide. Vitamin A deficiency also increases the risk of respiratory diseases like pneumonia and other infections like measles. It can also lead to skin issues and anemia. Notice that many of these foods are orange. Orange foods contain beta-carotene, which is converted into vitamin A in the body. So foods that contain vitamin A include sweet potatoes, spinach, carrots, cantaloupe, sweet peppers, and mango. Vitamin B12 is necessary for nerve and brain health, red blood cell formation, bone health, and insulin sensitivity. Some signs and symptoms of vitamin B12 deficiency include megaloblastic anemia, which is abnormally large red blood cells, which can present as fatigue, pale skin, and weight loss. Low B12 can also cause heart palpitations and numbness in the hands and feet, which mimics peripheral neuropathy and diabetes. B12 deficiency has also been linked to dementia and infertility. Some food sources of vitamin B12 include organ meats, beef, clams, fish like tuna and salmon, eggs, and dairy, milk, yogurt, and cheese. Notice that all of these food sources are animal-based. For this reason, a supplement is necessary to achieve optimal levels for those who follow plant-based eating patterns. Some of the functions of vitamin C include antioxidant and anti-inflammatory properties. It supports immune health, regulates gene expression, improves absorption of iron, and is necessary for collagen formation, supports skin, bones, and muscle health, and supports wound healing. A vitamin C deficiency is also known as scurvy. Some signs of scurvy include poor appetite and growth, impaired wound healing, painful swollen gums and tooth loss, impaired immunity, pain in the extremities and skeletal muscle loss, and increased capillary fragility and bruising. Food sources for vitamin C include rose hips, guava, strawberries, citrus fruits, sweet peppers, parsley, kale, and even broccoli. It is best to find fresh, local produce when you can, because vitamin C is fragile and starts to degrade right after picking, and more can be lost with certain cooking methods. Calcium is important for bone health, muscle health, blood clotting, nerve function, and thyroid function. Taking calcium with vitamin D helps to increase its absorption. Calcium deficiency can cause osteoporosis and brittle bones, poor dental health, cataracts, muscle cramps, weak and brittle nails, inflamed, itchy, and dry skin, as well as hair loss. Some foods that contain calcium include dairy products like yogurt, cheese, and milk, or fish that contain small bones like sardines or salmon. But there are non-dairy sources as well. Leafy greens, tofu, and soybeans, figs, and seeds like chia seeds also contain significant amounts of calcium. So sufficient calcium is possible to achieve with a plant-based diet. Chromium is essential for fat and carbohydrate metabolism, energy production, and insulin function. Low levels of chromium can lead to skin issues, low energy and fatigue, poor blood sugar control, weak bones, poor memory, decreased concentration, and appetite changes. There's also an increased risk of high cholesterol and heart disease. Some food sources of chromium include ham or beef, but also plant-based sources like brewer's yeast, apples, green beans, and bananas. Vitamin D is essential for calcium and phosphorus balance, bone health, muscle strength, and function. Vitamin D also reduces inflammation. Severe vitamin D deficiency in children is also known as rickets, which can cause severe bone deformities. In older adults, vitamin D deficiency can increase the risk for osteoporosis, dental issues, and hormonal issues. Low vitamin D levels have also been linked to heart disease, depression, diabetes, and cancer. Unfortunately, there are very few reliable sources of vitamin D in our foods. Our body can make vitamin D from the sun. People who have a lack of sun exposure, like during the winter months or working indoors, or the elderly, usually need a vitamin D supplement to achieve optimal levels. Folate is the key to healthy cell growth and function, the making of DNA and RNA, and is necessary for the formation of red blood cells. Folate is also part of the methylation pathway, which helps the body with detoxification. Folate also reduces the risk for birth defects and preterm birth. A folate deficiency can also show up as anemia, with weakness and fatigue, difficulty concentrating, irritability, and headaches. A person with a folate deficiency may also have mouth or tongue sores and changes in skin, hair, or fingernail pigmentation. As mentioned previously, folate is part of the methylation pathway, which is part of the body's detoxification process. There is a higher risk for dementia and neural tube birth defects like spina bifida, women of childbearing age, if they do not have enough folate. Some foods that are good sources of folate include legumes, beans, peas, and lentils, nuts like almonds and walnuts, asparagus, leafy greens, citrus fruits, and the brassica family like broccoli and Brussels sprouts. Next is iron. Iron is a necessary component of red blood cells. Iron is used to form hemoglobin, the part of the red blood cell that carries oxygen around the body. Iron is also involved in immunity and brain health. Mood and emotional health is also influenced by iron levels. Ferritin levels, which are the stored iron levels, have been shown to be lower in people with depression and mood disorders. Vitamin C helps our bodies absorb a specific form of iron more easily. Iron deficiency appears as weakness and fatigue, anemia, poor endurance, inability to maintain body temperature, so you're always cold, poor concentration, decreased immune function, and impaired development in children. Food sources for iron are divided into two categories, heme and non-heme iron. Heme iron is found in meat sources like lean meat and seafood. Heme iron is easily absorbed by the body. In fact, consuming heme iron can lead to excessive iron levels, which can lead to inflammation and damage of our organs. Non-heme iron is found in non-meat sources like vegetables, grains, and nuts. Non-heme iron allows our body to choose how much iron to absorb. So some good sources of iron include white beans, lentils, chickpeas, and tofu, spinach, and dark chocolate. Magnesium is important for energy production, which is converting food to energy. Magnesium helps with muscle contraction and relaxation. Magnesium regulates neurotransmitters that send messages throughout the brain and body. It also helps to form our genetic material, DNA and RNA, and regulates calcium to support bone structure. Magnesium deficiency may appear as fatigue, weakness, and loss of appetite, as well as nausea and vomiting. Someone with a magnesium deficiency may also experience muscle spasms or stiffness. Low magnesium levels may lead to an increase in blood pressure or blood glucose levels, brittle bones and osteoporosis, and worsening migraine symptoms. Some food sources for magnesium include nuts and seeds like almonds, cashews, flaxseed, and pumpkin seeds. Legumes like black beans, edamame, peanuts, and lima beans, quinoa, spinach, and dark chocolate. In fact, if you find yourself craving chocolate, it may be a sign that your body has low magnesium levels. The main function of phosphorus is to build healthy bones and teeth. It also has a major role in forming DNA and RNA, metabolism, muscle contractions, heart rhythm, and nerve signaling. Phosphorus deficiency is rare, but it can be seen in alcoholism, people in the intensive care unit, people who have had major trauma like severe burns, or sepsis, a life-threatening response to a major infection. Low phosphorus levels can be seen in people with certain medical conditions like Cushing's disease, hypothyroidism, parathyroid diseases, vitamin D deficiency, and COPD. Low phosphorus levels can lead to muscle weakness, bone pain, and increased risk for fractures, seizures, confusion, and a lack of coordination. Some animal-based foods containing phosphorus include eggs, dairy products like milk, hard cheeses, and cottage cheese, chicken, and sardines. Some plant-based options include seeds like hemp, chia, flax, sunflower, and pumpkin, oats, and nuts like Brazil nuts, cashews, almonds, and walnuts. Zinc is essential for immune function, wound healing, growth and development, especially in children, gene expression, and making DNA and proteins. Zinc deficiency can cause an increased risk of infections, slow growth and development, birth complications, diarrhea, changes in taste and smell, and delayed wound healing. Some animal-based foods containing zinc are seafood like shrimp, crab, and oysters. In fact, oysters have almost 3 times the recommended amount of zinc. Meats like beef, turkey, and pork, cheese, and sardines. Plant-based options include seeds like pumpkin, sesame, chia, and hemp, lentils, and beans like chickpeas, adzuki beans, and black beans. Since proton pump inhibitors can affect gut health, let's have a little conversation about why gut health is important. We have something called the microbiota in our bodies, which includes the microorganisms, so the bacteria, viruses, fungi, etc., and their environment. The microbiota in our gut lets in the good and keeps out the bad. This is called the intelligent barrier system. But dysbiosis, which is the unbalanced microbiome, can lead to leaky membranes in our intestines, which is the breakdown of the mucous membrane, which can let in large molecules like proteins into our bloodstream. And all of that can lead to systemic inflammation and infections. Another important feature of our gut is that most immune cells in our body are found in the gut-associated lymphoid tissue, or GALT system. Specialized immune regions called Peyer's patches allow for the communication from the GALT to the rest of the body. So this acts like an alarm system to the body that the immune system needs to be activated. Part of our defense system includes our stomach acid, and many bacteria species we encounter in our day-to-day lives cannot live in that level of acidity. So our body is protected from foreign invaders that we ingest. However, if we take acid-reducing medications, that defense system is weakened and allows the wrong kinds of microbes to enter our system and cause infection, inflammation, and dysbiosis. In case you're wondering, probiotics are usually specifically formulated to dissolve in the less acidic area of the intestines in order to deliver their beneficial bacteria species. The risk for a very serious infection from Clostridium difficile is higher in patients taking acid-reducing medications. C. diff is very hard to treat and is becoming resistant to many of our current treatments. So an ounce of prevention is worth a pound of cure, which means not getting the infection in the first place. The microbiome in your gut makes B vitamins, which are essential for most cellular processes, and making energy in the mitochondria. The microbiome also makes vitamin K, which is essential for blood clotting, and 90% or more of all of the serotonin in our body is in our gut. Serotonin is one of the neurotransmitters responsible for our mood. There are some chronic health conditions that are associated with poor gut health. They include obesity and metabolic disorders, and autoimmune disorders like rheumatoid arthritis, multiple sclerosis, and lupus, as well as inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Mood disorders like chronic depression and anxiety, colorectal cancer, skin disorders like psoriasis and eczema, as well as chronic allergies and asthma are also associated with poor gut health. We can also see endocrine diseases like diabetes and thyroid disorders, migraine headaches and hormonal imbalances like PCOS, endometriosis, and breast cancer linked to poor gut health. There's recent studies as well about Alzheimer's disease linking to gut health. Okay, so what are my recommendations? First, reduce, then eliminate fast and processed foods from your diet. These types of foods relax the sphincter connecting your esophagus to your stomach, or cause bloating, which can also open that connection, leading to heartburn and acid reflux. Second, switch to a plant-based eating plan. These foods can heal your body and gut and reduce heartburn symptoms. Third, take a probiotic for gut health. Having the wrong kinds of bacteria in the wrong places can increase your risk for ulcers, C. diff infections, or other conditions related to gut dysbiosis. Fourth, stop your acid-reducing medications. Work with your healthcare professional or pharmacist to stop taking these medications. Fifth, if you need a magnesium supplement, use magnesium glycinate, especially if you cannot do step number 4. If you have Barrett's esophagus or other reasons why you must take acid-reducing medications, please supplement with a magnesium supplement, like magnesium glycinate. This form of magnesium has better absorption than the cheaper supplements like magnesium oxide. Here is my list of references for this presentation. Thank you for watching this presentation in my series, Medication Class, The Pivot Perspective. I look forward to sharing more information with you in the future. Feel free to subscribe to my channel. If you're looking for more information on this topic or other topics now, you can check out my website, www.dramynaprick.com. I write a free weekly blog post on a variety of health and wellness topics. You can also follow my Facebook page or follow me on LinkedIn, Instagram, or Twitter. Thank you again, and remember, food is medicine.